May is National Stroke Awareness Month, and it's important to remember that every second counts when dealing with a stroke.
Shantae Passmore explains how you can quickly identify the signs of a stroke, giving someone a crucial fighting chance.
Hey there, it's important to spot the signs of when someone is suffering from a stroke as soon as possible because it can give someone a fighting chance. It's one of the goals of Stroke Awareness Month to make sure people can act fast to save lives. And joining us to talk more about what people should know is Jeff Welsh from Right at Home. And Jeff, thanks for joining us. And I think I was telling you not too long ago, I'm not exactly sure I would know if someone was dealing with a stroke. And I guess the acronym has kind of grown in recent years.
Yes, it used to just be FAST. Now it's Be Fast. B is for balance. So if you see someone that's losing their balance, E for eyes, blurred vision, loss of vision, and then F for face. You see drooping face, mouth, or eye. A is for arms. So somebody who's feeling numbness in their arms, or if somebody maybe can't even move their arms, if they have dementia or something, you might lift their arms and see if they fall immediately. S is for speech, slurred speech. And T stands for time. Time is of the essence. You want to get 911 called immediately if you see some of those symptoms.
Right. And so you were mentioning to me there are different types of strokes. What do people need to know?
Well, there's two real main types of stroke. Ischemic, which is when a blood clot occurs in the brain or travels to the brain, and then hemorrhagic, which is when there's a hemorrhage or a bursting of a blood vessel in the brain and blood gets in the brain tissue and causes pressure, and that is a second kind of a stroke, less common. There's also something called a TIA or a mini stroke, and these are temporary effect. It's basically an ischemic stroke that does not have a lengthy effect, small stroke.
And how much of a role does family history play in strokes?
Heredity is one of the factors, but there are many others, and lifestyle is one of them. People who overuse alcohol, vaping and smoking can cause that. High blood pressure and high cholesterol are things that people should try to avoid or treat so that they don't become more susceptible to strokes.
Okay, and then just lastly, I think most often people think this is something that affects people when they're older, but all ages?
All ages. There are 800,000 strokes every year, and so it can happen at any time to anybody, and so it's not really a predictable thing. So you really have to be aware of when somebody is going through those original symptoms that I discussed.
Wow, Jeff, an important discussion. Thank you so much for your time. All right, we'll send it back over to you.
To learn more about stroke prevention and understand your risk factors, you can visit the American Stroke Association's website.